Right, welcome back everyone. A really important session. I'm delighted that we're going to be hearing from the NHS England Chief Executive, Amanda Pritchard, and many of you will know if you listened to the news this morning that there was an announcement about plans to try and eradicate cervical cancer by, I think, 2040. So I'm sure that's something that she'll want to talk about, and we very much want to take your questions in this session. So the plan is for her to give us a speech for about 15 minutes, and then she'll come and join me here, and we'll take questions from you and from me as far as is required. A reminder, you can submit your questions online as well, and don't forget to give feedback on any of our sessions. But let me welcome Amanda Pritchard, NHS Chief Executive, joining us now. Hello.
Thank you, Samira, and good morning, everybody. So, seeing the COVID inquiry unfold will, I'm sure for many of you, have been a reminder that for all the outpouring of respect and appreciation from the public, for all the camaraderie and innovation NHS staff displayed, it was an incredibly difficult time for so many colleagues. Just as we will never forget the contribution that every colleague made, so we shouldn't forget that many are still living with the effects of that period. And particularly because we now face a more complex job. I would say when I was here last year, I was open about the challenges in front of us. What I didn't predict was the NHS needing to tackle those challenges whilst also managing more than now 70 days of industrial action. I didn't predict your clinic teams needing to reschedule more than 1 million planned appointments, your senior clinical teams needing to ask all but the most seriously ill and injured to seek alternatives to 999 and A&E, or indeed your finance teams needing to deal with the cost of delivering the safest possible cover. We do now have welcome clarity on how the government want us to deal with those costs. And as a consequence, we've been able to release now, as you know, hundreds of millions to give to systems so that you can get on and prioritise patient safety and urgent emergency care going into winter. Even so, we know we will still have to make difficult choices, both nationally and locally, to balance the books. And I highlight the challenges of industrial action not to take sides, but to recognise your work in dealing with it, to recognise the toll that it has taken on colleagues as well as on patients, and to reflect, I hope that I strongly suspect you share, that the current talks are successful. Nor in highlighting that additional challenge do we seek to hide behind it. There were challenges before industrial action, and they will still be there, even without further strikes. I've always been honest about those challenges, but I have never said they are insurmountable. Not because I'm speaking with blind faith, but seeing how the NHS steps up, how you step up to deliver for patients in the most challenging of circumstances. And that's what you've done. That's what the NHS has done in its whole 75-year history. The NHS has never delivered more than it did in its 75th year. Record numbers of GP appointments, cancer checks, and people getting mental health support. Just compared to our 70th year, your work meant that almost 2,500 more people received an urgent cancer check, and 100 more people started cancer treatment. And it's not just cancer. Your hard work now also means over 8,500 more people access key diagnostic tests, over 800 people start elective care, and almost 7,000 more people have checkups. And all of that is every single day. In mental health, over 10,000 people, more people accessed community appointments every day. Whether through 111, 999, A&E, urgent community response teams or mental health crisis teams, thousands more people are accessing urgent emergency care every day. And that is before we get into the huge numbers of people who get help from GP teams, pharmacies, and community services. The NHS delivering more and more for patients every day. And as we look ahead into winter, we know it's going to be incredibly tough, and you are once again pulling out all the stops to keep services resilient. Thousands of extra beds, a rapid increase in virtual ward capacity, even deploying AI and at-home monitors to help the most vulnerable stay well at home. And that's just since last winter. Real progress, real delivery. But it's still not enough. We still have much more to do on access, but also on quality and on experience. The tragic case of Martha Mills was a case in point, the story told by Martha's mother of watching her daughter deteriorate, but not being listened to. I suspect that affected all of us. We already knew we needed to do more to ensure the voice of parents, to ensure the voice of patients, to ensure the voice of families and their loved ones is heard in clinical care. That's why we were already working with exemplars like colleagues at the Royal Berkshire to test and spread ways of embedding the right to a second opinion. It's also why we were developing the paediatric early warning system with clinicians and patient groups now being rolled out with a clear focus on asking parents and recording what parents think about how their own child is doing. We have to continue that progress, and we will. But there are other areas too. Maternity and neonatal services, a clear example. Mental health and learning disability services, another. In both and in other areas, increasing capacity is important, but we must also focus on improving quality. And that's not just quality of care, it's quality of life. And you are delivering. I saw that vividly on a recent visit to the Cosy Cafe in Dudley. There, the team at Black Country Healthcare are working hand in glove with voluntary organisations and with patients themselves to support people with a learning disability and autistic people to lead the lives they want to lead. It's avoiding hospital admissions and acute care, but more importantly, it's delivering real change for people. A man I met there, a guy called Nathan, told me he was moving into his own flat, he was hoping to learn to drive, and he'd gone 9 weeks without harming himself. Previously unthinkable, but now he's doing it. And he's doing it thanks to the support he got from that joined-up, person-centred service. You're also delivering in other areas of care. Chris Whitty's report on Friday was the latest reminder that more people living longer is a good thing, but it's also one of the greatest challenges we will face over the coming years. The answer isn't just having capacity in the right place, it's about how we deliver quality of care, but more importantly, quality of life. And the NHS cannot do that alone. A couple of weeks ago, I went to spend time with the team at the Jean Bishop Centre up in Hull. They bring together a range of services for older people in their area living with frailty. That's NHS, it's social care, voluntary sector, even fire and rescue services, all working together with the goal of helping local people lead happier and healthier lives in old age. And it is working. They're seeing the need for acute care go down with 18% fewer A&E attendances and 25% fewer emergency admissions. So we won't relent on the focus on recovery. That's urgent emergency care, that's electives, that's cancer, primary care. They have to be the priority right now because we know those are the things that really matter to people. But we also know we must have an eye on the longer term. We all want to see a country which is healthier physically and mentally, one where people are given and take more control over their own health and care in the way that those teams in Dudley and in Hull are doing. As the NHS always has, we'll always harness the best medicines and innovations that help deliver that goal. And thanks to our unique ability to do deals on a national scale, we're already leading the world in eradicating hepatitis C and ending new cases of HIV. We've rapidly rolled out direct oral anticoagulants to 500,000 people in 18 months to prevent thousands of strokes. We're offering tens of thousands of women now the chance to reduce their risk of breast cancer by taking a drug that was previously used for treatment and repurposing it for prevention. And our pilots have provided the evidence to support wider use of closed-loop systems for people living with type 1 diabetes. And today, Samira's already mentioned it, but we are setting ourselves a new and ambitious target to be one of the first countries in the world to eradicate cervical cancer. School teams have already delivered protection from HPV to millions of young people, directly preventing an estimated 450 cancers. By continuing to make it easier to access and catch up on vaccines and continuing to make progress on screening, we can eradicate the threat of HPV by 2040, sparing thousands more women the pain and worry of cancer. It is truly momentous to be able to set out such an important and life-saving ambition today. To eliminate cervical cancer would be an incredible achievement, and through a combination of our HPV vaccination programme and our highly effective cervical cancer screening programme, it could become a reality in the next 2 decades. As ever, the public can play their part too. Achieving our goal needs as many people as possible taking up the offer. So our message to the public is, please don't delay. This could save your life. The future will hold other exciting possibilities, and we want to deliver those too. New drugs for Alzheimer's, a great example of that hope. And that's why we're preparing now for their potential approval. But as Chris Whitty's report reminded us, more people living longer means more people developing dementia. And whether or not people can benefit from new treatments, diagnosis is the gateway to support for them and for their families. A dementia diagnosis can be, and many of you will have experienced this with your own families, it can be incredibly daunting. But an early diagnosis can ensure that people get the support they need as quickly as possible. And there are many things we can do to support people, and importantly, there is support for families and for carers too. We know that the pandemic hampered identification efforts, so we've been delivering a sort of catch-up programme for dementia diagnosis, including piloting proactive assessments in care homes, and it is working. So thanks to the efforts of NHS staff, tens of thousands more people are now getting a diagnosis than this time last year, opening doors to further support for patients and their families who suffer from this heartbreaking disease. Like Laura Hudson, a mental health nurse from King's Lynn. She used the tool behind the outreach pilots, and she got her mum, Pam, herself a former nurse, the diagnosis which gave them peace of mind that she will get the care she needs. Makes a real difference for them both. So we will press on with those efforts and outreach work to detect dementia earlier, because behind every number, there's a Pam and there's a real person. And I am determined that by next year, we will once again reach our ambition of diagnosing 2/3 of people with dementia so they don't have to go through it alone. But as the example of dementia shows, while delivering innovative tests and treatments will always be part of the NHS success story, it will always be people who make the biggest difference. Thinking about all the things we know we need to do, all the opportunities that system and partnership working present, in all cases, the key to success is people. And that is why the publication of the NHS Long-Term Workforce Plan was such a seminal moment in the history of the NHS. In taking that unprecedented opportunity, we made a real statement of our ambition for the future, and in securing government backing for the plan, we secured an important vote of confidence in the NHS, in what we want to deliver for patients and in our ability to deliver it. And when I say we, I mean we. NHS providers provided a strong voice in the debate, but it was all of you. You helped push for this plan, you helped design the plan, you helped convince the government. I'm so excited, I'm now bashing the microphone. You helped convince the government to back it, and the publication of the plan was therefore a major achievement for everyone here. But it was just the beginning. We worked together to design it. We must now work together to deliver it too. But that work, of course, has already started. Many elements of the plan, the new training places, routes and roles, they're important for the future, and the work is underway now to make them real. But they're not going to deliver the boost to the workforce we need right now. That's where the retain part of the plan comes in. It's those actions that we can make progress on right now, and you are already delivering. The NHS leaver rate is already down, so from 9.4% in August 2022 to 8.1% in August this year. And while that might not sound like much, that is around 14,000 fewer people leaving. So that's 14,000 more people with skills and training and experience staying in their roles. That's people like Jeanette, a housekeeper I met at Hull Royal Infirmary, 52 years in the NHS, and she isn't done yet. She knew literally every inch of Ward 12, knew how to get things done as thoroughly and efficiently as possible. Her experience helping others develop and helping the team deliver for patients. That improvement in retention is also driving growth in our clinical workforce, up 5% in the last year in trusts alone, and in real terms, over 32,000 more full-time equivalent clinicians in our services and providing patient care. Real progress. But we can do more, and you are showing the way. Through our Exemplar programme, 23 trusts are implementing action plans to address what their own staff say would make them want to stay. So at Lancashire and South Cumbria, it's advocates on hand to talk to staff thinking of leaving. At Guy's and St Thomas's, my old place, it's training 4,000 line managers to have those conversations with their teams. At United Lincolnshire, it's a focus on supporting flexible working for people juggling work and family life. And it is working. Their leaver rates are improving even faster than the rest of the NHS. So if everyone made the same progress, we'd see thousands more staff choosing to stay in the NHS. Tens of thousands more years' worth of experience, training and investment retained for the benefit of patients. So we'll be keeping our foot on the gas, and we will be shortly inviting more trusts to join the Exemplar programme, so levelling up staff experience and retention nationwide, and ultimately, of course, delivering better care for our patients. Already, not just a plan, a banner under which you and your colleagues are rallying to improve how we look after our staff, and by extension, those who need us. But there's more to do. The plan is very clear about that. For one, we talked about it already this morning, but increasing productivity and continuous improvement, vital, both to keep up with rising demand and to give staff the space to transform care for the future. And you're delivering that too, through Get It Right First Time programmes, Further Faster, and increasingly through NHS Impact, you're using and sharing data and best practice to deliver better and more efficient care. And it is working. At University Hospitals Leicester, meticulous action to improve systems and processes have seen their elective waiting list fall by more than 11,000 in a year, and a 68% fall in long waits for diagnostics. The plan also talks about modernising our infrastructure, ensuring it supports, not thwarts, the improvements you want to make. That's our physical estate, but it's also our equipment, particularly diagnostic scanners, where we've seen a real focus with the rollout of community diagnostic centres. So I've done a lot of travelling recently, but I was in Barnsley a few weeks ago at the Glassworks Community Diagnostic Centre, and I met a patient there called Ronald. And Ronald needs a blood test every 3 months. Previously, he'd go to the hospital. Now, he loves the fact that he can just come into the centre of town. He can park his car, he can get his test done, then he can browse the local shops or get a coffee, just as he would on a normal day. So yes, CDCs are helping us ramp up activity and reduce the backlog, but they're also making a huge difference for patients like Ronald in terms of their experience. So, our physical infrastructure is important, but increasingly important is our virtual infrastructure, our digital platforms and our data architecture. Things that support patients to get what they need more easily, like the NHS app, which is rapidly becoming now a one-stop shop for many services. Thanks to your work supporting the development of the app, 3.4 million secondary care appointments were booked or managed through the app in September alone. But it's also things that help you plan and deliver care more effectively, like electronic patient records. Thanks to the team at Sheffield Health and Social Care and Hillingdon Hospitals, who completed their go-lives over the last couple of weeks, you have now delivered on the target for 90% of trusts to have this capability in place ahead of winter. Delivering that switch isn't easy, but it is worth it. And it's worth it because that's the underpinning work that will enable us to benefit from new technologies. Technologies like the Federated Data Platform, which we're working hard to finalise now, so we can provide clinicians and managers with powerful tools to bring together the data you hold in different systems and harness it to improve care. Tools of the kind that colleagues across the country have already shown can make a real difference, like in North Tees and Hartlepool, where their clinical team uses them to support discharge planning, which means patients going home with the right support faster, long stays falling by over a third, despite admissions growing, and almost 10 hours of clinician time freed up each week. The other major shift will be strengthening our incredible primary and community care services, who already account for so much of what the NHS does. So like in Dudley, like in Hull, improving how they work together and with other services to provide more services closer to people's homes, more convenient, more personalised, more preventative care. In integrated care systems, we have the platform for that now in every place and in every part of the country. And I've been really delighted to see how well providers have embraced that system-first approach. So that's what we want to achieve with the long-term workforce plan. People. People working in decent facilities, supported to reach their potential, with the right tools to work productively, with the agency to keep improving how they work, and with the partnerships in place to ensure they can deliver what patients need and want. That's what will help us face the challenges of the next 5, 10, 15 years. That's what we all now need to work to deliver. And that is not ignoring the immediate challenges, the focus we need to maintain on recovery, on access, on quality, and on safety. But the success of the NHS over the last 75 years, the enduring support of the public, has been because people like you have carefully balanced both, delivering the best possible care they could in the moment, but also identifying and delivering improvements that make a difference for the future. And that's exactly what I want to continue to see when I come and spend time with all of you everywhere. It's what I also do see. I see real pressures, but I see real progress, real promise, and real pride. I know it's tough. I know it will be tough. But what you're doing is delivering for our patients. What you're doing is making a difference. So thank you for that. And let's keep delivering together. Thank you.
Thank you so much, Amanda. If you want to come sit, I've got a fresh glass here and we've got a microphone for you. So a couple of lovely little questions have come in online already and we'll come to the room in just a moment. Here's one you might be able to answer. What was the first question you asked the new Secretary of State? I assume you've spoken to her.
Sorry. Thank you. Well, I wonder if you'd be interested in knowing the first question she asked me.
Both, yeah.
The first question she asked me was, what can I do to help you?
What did you say?
Actually, we then had a very wide-ranging discussion.
Got a list.
But it will be unsurprising to know that one of the first things we did talk about was industrial action. Right. So we've been really clear. We have consistently, and I know colleagues and NHS providers and others have the whole time talked about the impact industrial action has had on patients, talked about the impact it has had on our own teams and colleagues, talked about the impact it's had on finances, but also called on all sides to work together to find a resolution. So that was one of the many things we discussed.
So it does feel like there might be kind of different atmosphere in the department. Another question that's come in, which seemed a good one to ask, given the content of your speech. How confident are you that with the recent announcement on funding, that systems can deliver the financial plan? Is it just a fantasy that we're being asked to play along with, or is there genuine belief it is possible?
So I think, look, I'm the NHS Chief Executive. I'm always going to want more funding for the NHS. That's probably not a surprise. But I think in the allocation that we now have, we have two things that are really important. We have certainty, because I think it's been very disruptive, not being clear what was going to happen, not happen around the costs of industrial action in particular. But secondly, we also have a recognition from government that that is going to require hard choices. So in the letter that hopefully everybody received last week, what we were able to say was, right, that's going straight out to systems. So that allows people then to focus on the priorities which have got to be patient safety and have got to be about urgent emergency care over winter, but it recognises, in terms of where are the hard choices, that we will have to now, we've agreed with government, reduce the activity target for elective work, and therefore that is likely to have an impact on how quickly people are able to deliver the elective activity goals. Although, of course, I know colleagues will continue to, and we've asked them to, concentrate on providing care for those who have the most urgent needs, as well as those who've been waiting the longest.
One related question, again, which is coming online. What can be done to better protect the public health grant? Preventative work is slowly being eroded due to council budget challenges. And of course, this feeds into then people who then present with more chronic conditions down the line.
Yeah, I thought it was really nice to hear when the Secretary of State gave her pre-record earlier, her talking about being Secretary of State for Social Care as well as Secretary of State for Health, because of course the funding for that goes through a different route, so actually it goes through the local government side. It's one of the things that certainly we would recognise we can't control, in the sense that none of that comes through the NHS, but what we can certainly do is continue to work with colleagues across government to emphasise the importance of that focus on public health and prevention, and I think it would be unsurprised for this audience to hear that that's also something that is very important to the Chief Medical Officer, and something that he calls out, of course, in the report he wrote last week as well.
Fantastic. We'll take questions from the room then, if you want to put your hands up in the air, and if the people with microphones can spot you. Thank you for raising the lights a bit. Wave your arm around. Right, there's one over here. Thank you.
Hi there. Hi, Siobhan Melia, Chief Executive at Sussex Community. First of all, Amanda, I just want to say thank you for your energy and optimism. I mean, the fact that you hit the microphone a couple of times is really welcome this morning, because, you know, there aren't that many reasons to be optimistic, and I think it is really great to hear you with the energy that you had this morning. I guess the question that I have is around the long-term workforce plan. So again, really welcome the focus on people, and it just feels that there could be a bit of dissonance as your message reaches systems and providers, because we are holding that tricky balance of the financial challenge, winter around the corner, and an attempt to say to people, we feel your pain as you feel ours, and that the challenges are not insurmountable. We can do this together. But as you said in your opening, the impact of the pandemic and the attritional nature of that is tough. So what can we do together to align on the message around people and valuing our people as we enter the winter?
Thank you.
Do you want me to take that one first? Thank you, Siobhan. It's a really important question, because I think it sort of goes a bit back to the question about the money and how realistic is it. I think the thing that, and it is the thing that's really helpful about where we are now, is I think we've been given, we've got an explicit understanding that there have to be some choices. And I think that makes it feel, at least to me, a much more realistic conversation. And yet, in describing that, that's always to some extent going to be disheartening, because there will be colleagues, I'm aware of this, really aware of this, who've just worked so unbelievably hard on things like, it's not so much relevant to community services, but in the acute side have worked unbelievably hard on elective recovery. They're not going to want to let go of that. So anything where there are choices, somebody's going to feel that, and I think I'm very conscious we've got to hold staff through that, because partly that's a moment in time thing, and there's a bit of defer, not stop, but there's also a bit of just, it does give us a baseline to then talk about what we can do together in a more realistic way. So what can we do together in a more realistic way? So I would like to say, I mean, you heard me talk about it, sort of people becoming a bit of an overarching sort of banner that we put everything else under, because we know we can't do anything without our people. So that's partly why, without trying to be overly positive about things, I do think pointing to things that are going well is important. So the fact that leaver rates have dropped so much, actually, that's really important, because materially that means more experienced colleagues to work together, and we know that teams and effective teams are really important. It also, looking at some of the things that are being done in those trusts that are the pioneers of the retention work, they are with a little bit of central funding support, it's been really impressive how people have leveraged that to be able to make a real difference locally, just by really listening to what means the most to people in that local circumstances and being able to do something about it. So rolling that out feels to me like the sort of thing that people will probably want, hopefully, to do and see as a genuine opportunity. So I think it's looking for those things where we can find a balance between saying, we recognise it's really difficult, I'm just talking about the money, but there are lots of other examples. However, we are actually making progress, and we can point to that both in terms of progress in things that are meaningful for our staff, but also progress in things that are really meaningful for our patients. And I think that gives, certainly me, a sense of actually balance in the way that we're approaching this, and real hope that actually there is a believable bridge to a future where some of those long-term investments in the workforce plan, in tech, in capital, in prevention, will get us to a place where the NHS actually is increasingly able to exploit some of the brilliant stuff we do on innovation, on new medicines, etc., to the benefit of all our staff and all our patients.
Fantastic, thank you. Here's a question that's come in from Haris Sultan, who's director at West Yorkshire ICB. How do you plan to safeguard the healthcare needs of children and young people amidst the winter pressures faced by the NHS?
That's a really good question, because I think there is again, as ever, I feel like I'm always talking about the sort of now and future, but in a sense, I think as leaders, we always have to think like that, don't we? So there is a here-now set of things. So we know some of the things you're rolling out, started doing it last year, doing it again this year, but at a greater scale. So things like the respiratory hubs for children, things like some of, I actually don't know whether West Yorkshire is doing it, but some ICBs have rolled out the app that is specifically designed to give parents information about children's health and signpost them to local resources. Many of you I know have also really doing a lot of work to put clinicians with expertise in caring for children as part of your 111 setups and as part of your ambulance response structures. So those are the sorts of things that I know are the very practical things that are happening now for winter. Looking to the longer term, I thought it was a brilliant debate, by the way, this morning. I thought it was a really thoughtful discussion from a really impressive panel. But one of the things that I would recognise as being something that certainly we're trying to talk about more and do more thinking about strategically, as well as thinking with colleagues, many colleagues here, about what we can do in the medium term, is around that bigger agenda, I think, for children and young people, and particularly community services. So thinking about neurodiversity, thinking about ADHD, autism, thinking about that in the round with what it means for education providers, social care, etc. So I am extremely keen, you heard it first here, probably not because I talk about it quite a lot, that we do now, and I've actually asked the team inside NHS England to start doing some joined up strategic thinking about what a future model could look like, which is much more based on what Therese was saying earlier about Bradford, where you put the you change the way you think about where the diagnosis fits in the way that you organise and provide care for kids. So that's a longer term thing. I recognise that's not an overnight, let's fix it today, but I think it's the right thing for us to be working on, and it's something that certainly I'm very clear the NHS needs to do with others, not something we can sort of sit and do on our own.
Related to that, there's been real concern about the crisis in young people's mental health care, just the scale of need, a lot of that, of course, triggered by the COVID lockdowns. What's your view about how far that's being tackled and can be tackled?
Yeah, so again, a couple of things on that. So I think thank you to everybody who supported the rollout of mental health teams in schools. That is one of the things that we've done way ahead of time. So really seems to be making a big difference where that's rolled out, and we're on track to continue that for the rest of this year and into next year. But that's not designed for, of course, children and young people who have the most acute needs. So if I go back to the long-term plan 2019. We're providing now, or you are providing, a third more care for children and young people mental health services than at that point. So it has gone up dramatically. Guess what? Demand has gone up much higher, much more quickly. So it's a mixed story. It's a real success story for what the NHS said that we would do in increasing the provision of mental health services for children and young people. I mean, wow, the numbers are impressive, but it is a really big challenge because the treatment gap hasn't closed. Because the demand has gone up, and partly driven by COVID, but not only. So I think that is all part of certainly what I would like us to be doing, partly with the current government and partly recognising that there is a general election. Our thinking always has to be sort of beyond just political cycles and thinking about what a broader strategy for mental health services, but not just mental health services, services for children and young people would need to look like, could look like over the longer term.
Thank you. More questions in the room, please. Yes, gentleman over there. Is another one on this side? Yes, and the lady down here after that, please. Thank you.
May I echo my previous speaker's comments to you about your passion? Always amazed how you maintain that passion.
Just remind us where you're from, just for the benefit of those listening.
Jacktar Singh from Coventry Warwick Partnership Trust. Okay. Amanda, one of the big questions we keep getting challenged about is the NHS deficit. The big part of that is the structural deficit of historical underspends, such as capital. How are we ever going to deal with that structural deficit if we keep focusing on just the numbers?
Thank you. Yeah, the issue about long-term capital investment which keeps being pushed to the back of the queue, doesn't it?
Well, so over the last, 20 years, 15 years, I think organisations like the King's Fund, the Health Foundation have described really clearly exactly what you've just said, Jag, which is just the cumulative impact of where we are on capital. What is definitely welcome is even in the long-term workforce plan, there was a clear recognition that if we're going to achieve the benefits that we're describing in the long-term workforce plan, that will require, as I was just saying, people working in buildings that actually enable them to do their jobs rather than disable them from doing it. And I know I've said it before, but honestly, I worry more about some of our primary care estate and some of our mental health estate than I do about our hospitals, even though that's often where the focus is. But secondly, it is also our virtual estate, because we've written it in the long-term plan. We're not going to be able to get people to be able to work the way that we're describing for the benefit of our patients if they are not able to do so as productively and efficiently as possible because they haven't got the digital infrastructure support that they need. And the government has recognised that. So they have committed, in signing up to support the long-term workforce plan, they have committed to a rolling programme now of capital replacement, which I think, yet to see the detail, but it's very welcome to see that that has been recognised as explicitly. And we do know that actually under our previous Secretary of State, there was a real focus on continuing to drive technology and investment in technology, data and digital. So we've seen big improvements with the app. As I say, we're working on the federated data platform at the moment. That will be a big thing. if we conclude that process, because that's, would have been unthinkable a few years ago, because how do you join up data if you're still on paper? But the fact that we've been able to get to, I've just said it, 90% of organisations now with electronic patient records begins to give you the opportunity to say, right, we've now got the platform that you can start to join up data to really make a difference. So I think a continuation of the focus from all of us on the importance of that long-term planning for capital would be really important, and also, as I say, welcome the commitments that we've had so far that recognise how central that's going to be if we are going to deliver our ambitions for the kind of health service we know we need in the future.
Fantastic, thank you. And there was a lady over here, yes.
Thank you. My name's Linda Thomas and I'm Chair of Norfolk Community NHS Trust. This is my first year in the NHS, so completely different to so many colleagues in the room. I wanted to ask you if you could give me some advice, Amanda, on the issue of prevention. So I think one of the biggest things that we're grappling with at trust level and at system level is how do we balance the day-to-day crises and staffing and workforce shortages and funding with keeping more than half an eye on the future and the prevention agenda. And you talked about 5, 10, 15 years. And this feels hard at trust and at system level. And I wanted to just pull two parts of that out, I guess. One is, like you, I love getting out and about, and going out and seeing our workforce in action every day. But what I think a lot of them are doing is they are dealing with crises that could have been avoided if they had been able to see patients much earlier on in their journeys, particularly with things like diabetes and all sorts of things that we see in the community. This doesn't really play very well from a staff retention and satisfaction perspective, so it would be lovely to be able to give them the opportunity to be able to practice what they're best at.
So can I get you to ask the question, I think?
But most importantly, the impact on patients, keeping people well for longer. So what advice would you give us as trusts to be able to manage that balance?
Fantastic.
Sorry if that was too long.
No, that was, the context was really important, and it's a question that's come up repeatedly, that balance between managing, what feels like a crisis of people presenting late, and then the future focus.
Yeah, brilliant
Thank
question.
you.
And it's really important because, in a sense, I would say there's a... Again, there are layers to the answer to this, and probably people in the audience who can contribute to this debate and may indeed want to do so after the end of the session. So a number of things to say. First is, I think there's a really important thing for me about what is the NHS's role in prevention. So we know that directly it's 10%. And in partnership, probably 20%. But you know what? Let's make sure we're doing that bit, because that is our job. So I talked about earlier, how exciting is it to think that we could actually eliminate cervical cancer? But we can do that because we've got incredibly impressive and effective vaccination programs and screening programs. But the work that you will be doing locally, particularly around outreach, around building confidence from, groups, colleagues, communities that are traditionally underserved, where there might be hesitancy, that is going to be absolutely crucial if we're going to be able to turn our ambitions into the kind of outcomes that we're looking for. Equally, if Professor Powis was here, he would say cardiovascular health. So it's blood pressure monitoring, it's making sure every contact counts. So if someone's coming into contact with your services, are we maximising the opportunity to do the wraparound care to make sure we're signposting to other things or indeed providing them in the moment. So there's a bit for me which is like, that's the core job. Then there's the bit that says, right, but as we think beyond that, what can we do in partnership? That is the brilliant opportunity we now have with ICSs. And what I see particularly around the country is that's where place is really beginning to come into its own, because that ability to understand your population at place, but also build the partnerships often with voluntary sector, with local government at place, is where some of those wider opportunities sit, and particularly as we think about the wider determinants of health. Then there's a third bit, which I think you're also rightly signposting, which is less about prevention, but more about how do we get upstream in treatment. So rather than waiting for the crisis when someone presents at A&E, how much can we do? And that's particularly where, again, I shout it out in my speech a moment ago, but where I see some of the most effective joint working between primary care, community care, the integrated neighbourhood teams that Claire Fuller wrote about in her stocktake, and really beginning to say, well, we know our population, and if we can make sure that by coordinating care, so Jean Bishop's a great example, they've started at the very top end, end, if you like. So if you think about your population triangle, they've gone in at that highest level of need, most complex, most frail patients, but they are seeing, by coordinating care and by getting upstream, annual comprehensive assessment as well as a more reactive model as well, they are stopping people coming into hospital. They are stopping people spending time in the backs of ambulances, going into hospitals for acute care, and they are seeing a real difference, not just on some of those sorts of metrics, but actually on people's quality of life and on their ability to stay independent and have really meaningful, really joyful lives well into old age. So I think we've got some, so I would say you'll all be thinking about all of those dimensions, I know. But as I say, one of the great joys for me about being able to go out and visit so many of you is that I see it's not just pipe dream stuff. It's real, it's happening. And I think I would say that would be, if you want advice, and you shouldn't really take it from me on this, you'll take it from others who are much more experienced. But that is really where it's the value of working in partnership that I would particularly highlight.
Thank you. I have a great final question, and really what I've taken away from both your speech and your response to the questions is, having led NHS England through a time of unprecedented crisis, to find all these positives to talk about, especially at a time when I think what's emerged from the COVID inquiry was a sense that elements of our political leadership just assumed NHS staff could be run into the ground, that there was this infinite capacity for them to just keep working. And I think an acknowledgement that staff retention and building staff resilience for the future is something that can't be taken for granted. So thank you for emphasising all that. Thank you very much to Amanda Pritchard for joining us. Thank you.
Thank you.
So just to let you know what happens next, that's the end of our plenary sessions for this morning. We would appreciate your feedback on this session, so you can rate it using the instructions shown on the screen behind me. Time for a refreshment break, so make your way to the exhibition hall where teas and coffees will be served till 11:20, and the delivering with partner sessions will be taking place in the exhibition theatres during the breaks, so please do attend those sessions and do visit the exhibition stands and the providers deliver area. We'll be back in this room at 1:20 for the closing sessions of the conference, where we'll hear from the Shadow Secretary of State and then welcome a panel discussion on what the public should expect from the future NHS. Thank you all, and thank you again, Amanda. Thank you.